Welcome everyone, and thank you for joining our webinar today on bringing a global health perspective into your course. My name is Suzanne Walker, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones & Bartlett Learning. For those of you who are not familiar with Jones & Bartlett Learning, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. And now I'd like to introduce our presenter, Richard Skolnick. Richard has more than 40 years experience working on international development and global health, including 25 years at the World Bank. He's a former lecturer at the Yale School of Public Health and the Yale School of Management, and he is also author of the best-selling text, Global Health 101, 4th edition, and the forthcoming text, Global Population Health, a Primer, which will be out next month. And with that, I'd like to turn the presentation over to Richard. Welcome.
Suzanne, thank you very much. And I'd very much like to thank all of those who've joined us today. It's heartening to see so many people interested in this and teaching public health and nursing and healthcare management and a range of related fields. It's heartening as well to see people from a number of universities and colleges and other schools with which I'm familiar. I grew up in Dayton, Ohio, so I have to give a shout out to the people who are attending from Wright State, and I taught at George Washington as well, and I'm very happy to see them. But as I say, I'm very, very pleased to see people from so many different centers of learning, and so many with which I'm happy to say I have some familiarity as well. It's a real honor and pleasure to be here today, and I wanted to take 2 seconds to talk about some of the perspectives that I'm going to bring to this discussion of trying to bring a global health perspective to your courses. As Suzanne mentioned, I'm going to bring to this the perspective of a global health practitioner for many years, who then became both a practitioner and a global health educator, and would like to think that I remain actively involved in both fields. I've not taught public health per se, or nursing or healthcare management. All of my teaching has been on the side of global health. There's much that we can learn from each other. And in all of the previous webinars in which I participated, people were very gracious to share ideas. So I want right at the beginning to let you know that if you have ideas that you'd like to share, that you think can be of benefit to others, or you have ideas you'd like to probe, you're more than welcome to share them with me. You'll see my email at the end. And then what I would do is write up a blog about this for Jones and Bartlett. We'd post it. We'd be sure you all get copies. We'd hope that in that way, we can build from this webinar and help to learn even more from each other. Finally, let me say that I approach the webinar and everything I do, I hope, with profound humility in the presence of people like yourselves who are committed to making the world a better place, to making it a more healthy place, and who have a vast range of experience from which I hope to learn a lot myself. So let's go on and talk about the objectives of the seminar. The aim of the seminar, as we talk about here, is to discuss how it is that we might bring more global health perspectives to the range of courses in which all of you are involved. But when I teach, I like to say in a humble way, how is it that I hope we can be transformed by the class or by the discussion or by the presentation? And I'll be very happy if when you leave the webinar today, you feel more engaged in thinking about adding global health perspectives to your work, if you feel at least a little bit more inspired to do that, and if you as well come away with some ideas you didn't have before about how you might actually achieve those aims. So given COVID, it doesn't take much for anyone to understand these days why it's so important for us to try to ensure that in all of our work in public health and in nursing and in a range of other fields related to health, why it's so exceptionally important to be sure that we bring a global health perspective into that, and that we try to ensure that the learners with whom we're engaged can walk away from those courses with a bigger global health perspective than the one with which they walked in. We know we're living in a world that's very interdependent. And I like to say, and kind of my mantra is that the health of anyone, anywhere is the health of everyone, everywhere. And I think if we agree on that, then we really don't need to say much more about why it's so important to add a global health perspective. But recently I came across a very good quote from a former Minister of Health in Canada that I use in lots of my teaching and in many of the presentations that I make about why global health is important or why we should care about it. And what this former minister said, I think very, very well, was the most important reason for our study of global health is the recognition of our common humanity, our shared destiny, and the interconnected determinants of health. I think whether we're teaching a course in domestic public health or healthcare management or the management of hospitals in the United States, for reasons that we'll talk about as we go through this, I think it really is essential that they understand a global health perspective, our common humanity, our shared destiny, and the interconnected determinants. But in addition to that, and I'll give you a couple of examples, there are some areas of public health, for example, that are public goods, whether it's climate change or it's air pollution. We cannot really help our students, our learners, to understand these and to help to address them if they don't have a global perspective as they look at these topics. We know in the United States, where we have a very diverse society, that in many of our communities, and certainly in our largest cities, we have people who come from a very wide range of cultural backgrounds. And without an ability to think more globally than we might do at the start, it would be impossible to be a good healthcare practitioner. It would be impossible to be a good healthcare manager without understanding some things about the backgrounds of the people with whom we're working and the perspectives that they bring to us as they seek our services. We also know that there's much to learn from others. There are still people who believe that wherever they live, where they live is the best place and they know the most. But I'm sure that everyone in this call deeply believes that we have much to learn from each other, both within the United States, across the United States, and across the globe. And if we're thinking, for example, about the further enhancement of the healthcare system in the United States, I think it would be impossible, even as we know that all healthcare systems emerge from people's unique histories, from their unique societies. I certainly would hope that those who are working in the United States on the further development of the American healthcare system are keenly aware and have a deep understanding of the healthcare systems, for example, in the Netherlands, in Switzerland, and in Singapore, even among those three, which have a lot to say, for example, to the United States. So I know this is something all of you believe in. It's now become very obvious, but I wanted nonetheless to make a few comments about why I hope that no matter what are the courses in which we're engaged, and no matter how domestic, in quotes, in orientation they are, that we can help our students to leave with a much more global perspective than they entered with. There are some students who will walk into our classrooms with quite a global and quite a broad perspective. We hope that if we add the perspectives we're talking about today, that we can further enable them to understand the work that they're doing, to become much better and much more sensitive in the practice of it. But it's also true that many of us will have learners who aren't very experienced in global matters, who haven't had opportunities to travel, who don't have contacts from a broad range of cultural backgrounds, and for whom a global perspective doesn't come naturally. So as you go through your course, of course, you're going to notice who these are. You're going to tailor your teaching to the different backgrounds of your students. But again, I hope that in all of our work, we make an explicit objective out of hoping that our students who leave our courses, no matter how domestic, as I said, leave with a broader perspective on life than the one with which they came in. So there are many ways that we might bring a global perspective to our courses and to our work. All of you will be very familiar with these and with more, and I'm hoping again that you'll feel free to share good ideas that you have and allow me to share them with others as well. But we can add readings, we can make comments, we can use different cases, we can put on writing assignments, we can add an additional supplementary textbook, for example. And these are 5 of a range of ways. And what I'd like to do in much of the remaining time is talk a little bit more about each of them. So there are a wide range of newsletters, reports, regular articles that come from a wide range of groups that cover different global health topics, both on a daily basis, on a weekly basis, on a monthly basis, on a topical basis, and that could be of real value to you as you try to enhance the perspectives of your students. Some of these will be very brief and come out daily. Some will be longer articles. But for example, there's a number of newsletters. There are newsletters from the Center for Strategic and International Studies in Washington. There's the Global Health newsletter of the Kaiser Family Foundation. There's Global Health Now, which comes, as many of you will know, from a group at Johns Hopkins. And they're a good way of keeping up. They usually have paragraph coverage of different topics, for example, and they could be a very easy way of helping to add some global health perspective to what you're doing. If you ask, for example, for your students to subscribe to the Kaiser Family Foundation Global Health newsletter and pay particular attention, for example, in this week to items about equity, the week after to items about ethics, the week after that to matters that come up about health systems. I think this is relatively painless, but very enlightening in almost all regards. There are lots of fact sheets that come out. The WHO has a range of fact sheets. Some are a little older, some are newer, some are very recent. And on almost any topic, one could start with just the 1 or 2 page fact sheet of WHO. Today, we're going to talk about non-communicable diseases in the United States. But what I'd like you to do, for example, is take a look at the fact sheets that WHO has, both on NCDs in general and on ischemic heart disease, stroke, on chronic obstructive pulmonary disease and diabetes. And as we go through these topics in the next few days, I'd like to help you bring into the discussion some of how what we're discussing relates, for example, to some of what you'll be reading about in the WHO fact sheets. Of course, we're all overwhelmed. I think the number of journal articles that you will see is just a function of the number of subscriptions to which you have access. There are a number of newsletters that come in daily from the Lancet Global Health, the Lancet Infectious Diseases, the Lancet X, British Medical Journal, Journal of the American Medical Association, the American Journal of Public Health, and more. I think if you want to globalize your perspective on a domestically, in quotes, oriented course, and if you could only pick 1 or 2 things, probably just get the newsletter from the Lancet or the Lancet Global Health, and that will allow you in probably the easiest way to pick out journal articles that come from a reputable journal, are usually quite topical, and that you can fit into your courses in ways that on that topic or this topic, you can help your students to expand their horizons. And of course, there are reports galore, but again, from WHO, there are reports on tuberculosis, malaria, NCDs, neglected tropical diseases, health systems X and health systems Y, ethical priority setting. And then there are reports that emerge from time to time from groups like the Commonwealth Fund that take a very good comparative look at health systems across the high-income world. So here too, I think, probably in very selective ways, one could find some reports, at least the summary of which would be very helpful provoking our students into thinking in more global ways than they would, and bringing that to add to your discussions of equity, health systems, non-communicable diseases, etc. One of the things we've all learned about Zoom is that it's possible now, and much more possible and much more acceptable than before, to invite speakers to appear virtually in your classroom. I've done a lot of teaching this year for my friends at the University of Milan, for many of my friends in the United States, for friends at the University of Bergen in Norway. As you will appreciate, I certainly would have appreciated an invitation in normal times to enjoy 3 weeks in Milan, or to enjoy a week in Bergen, or to spend a week in San Francisco, or visit my friends at Wright State in Dayton. But that's very expensive, and we've always had questions about just how cost effective it is. I think we have sadly in some respects, but happily in others, what COVID has done is helped us understand there are many, probably much more cost effective ways of bringing speakers into our classrooms and to post-classroom experiences than inviting our friends, no matter how nice it is to see them physically. So I'll start in the middle here, but I think one of the things that you can do is bring into your classroom speakers with a range of experiences, including people, for example, with practical experience, or people who have actually lived with certain conditions or certain diseases, or who live in certain settings, which will allow your students to get a better feel for one topic or another. So, if you're interested in getting a speaker from WHO, or from UNICEF, or from the World Bank, or from another university, it's just much more possible than before, and lots of folks are trading visits with each other. If you're interested, for example, when you're talking about the social determinants of health, to have people from an organization in Liberia, or Sierra Leone, or Guatemala, or India speak with your students, many of them are more than happy to do that and talk about, for example, how it is that the social determinants of health play out in their country, and how it is that that compares with the manner in which they play out here. Or if you're talking about equity, if you're talking about health systems, it's certainly possible these days to bring in friends from the Netherlands, or friends from Norway, or friends from France, or friends from Brazil, to talk with your students and help them get a better understanding and a more comparative understanding of health systems than they would ever get by reading about it alone. So, I tried hard to do this when I was teaching. I'm always honored when I get asked to join others, but I think the opportunities for this are now enormous. And, it used to be hard to get to place X or place Y in Kansas or Nebraska, I say with deep affection, but it's no longer any more difficult than it is to go to Washington, D.C., or New York, or Boston, or San Francisco, or L.A. People from all over the world can now join us wherever we are, and I can't encourage you enough to do this. I'm sure, though, most of you won't need any encouragement at all. The second thing one can do is just make a conscious effort to bring a global perspective into what you're doing through your own comments. And that is, as you talk about equity, you say, and by the way, Sarah, how do you think that would play out in Brazil? Or John, given what you know about Nigeria, how do you think these equity issues play out there? Or when you're talking about social determinants, et cetera? I think all of you will be capable of trying to bring in this perspective. It's hard when we have so much to cover to do this, but I think if we say to ourselves as we enter each classroom, I want to remind myself that as I go through this discussion of culture and health, of health systems, of humanitarian work and health, I'm going to remind myself that I'm going to keep adding examples and provoking my students in ways that help us to broaden their perspectives as we do this. And lastly, I'm not a gigantic fan of looking at videos together, although from time to time in discussion sessions. I've done so, and it's worked very well. But there's just an incredible array of really wonderful videos on YouTube that one can assign that might only be 3, 4, or 5 minutes long that can really help to enhance the perspectives of our students. For kids who don't, for students, forgive me, for learners who don't understand what the real issues are in the link between water, sanitation, hygiene, and health in low-income countries or low or lower middle-income countries, there's a series of videos, for example, on the total sanitation campaign in Bangladesh that were always the favorites of my students. There's a range of extraordinarily touching visuals on maternal health and on fistula, for example, in Ethiopia, as well as a very good movie about it. Pardon me, as many of you will know. The one warning I want to give you is, and there are lists. I know Madhu Pai at McGill's made a list of videos. I have a list. But I want to warn you, don't go and search for global health videos, because what will happen is you'll find the videos of each of us giving talks. You'll find that my friends at Valparaiso are on YouTube giving a talk about the HIV outbreak in Indiana. You'll find that my talks at from friends at Texas Christian talking about why. What you have to do if you're going to search for YouTube videos to build on the lists or create your own is actually go in by topic. Equity in low-income countries, equity in India, equity in health in Brazil, deworming programs in Kenya, etc. Otherwise, I think you're not going to get anywhere. But I promise you, if you search for the right terms, you're really going to find an extraordinary array of really interesting videos. And again, for a student who's never seen poor woman in Rajasthan, India, carrying jugs on their head for an exceedingly long distance in order to go to an open water source. These can be really, really, really enlightening. And again, I'm not demeaning the knowledge or perspective of anybody, because these days, most kids have seen a lot. And yet there's something really, I think, moving and telling when you're listening to these young women talk themselves about what it's like to get water and what they know about how important that is for their health. I'm a big fan of written assignments in all of my courses. Having been a technocrat, I worked hard to try to ensure that the courses could also be used to help students learn how to write in the discipline or write policy briefs. And I think there are written assignments of varying lengths that can also be really helpful to enhancing the global perspective of your non-global health course. One way, for example, would be today we're talking about maternal and child health in the United States. What I'd like you to do for one of your written assignments is talk about maternal and child health in a low or middle income country, or how this plays out in Norway or Denmark or Italy or Greece, for example. Or one could, for example, ask students to compare and contrast. Although we've been talking largely about maternal and child health in the United States, your written assignment is actually to spend 2/3 of your time talking about maternal and child health in the United States, and then compare it and contrast it with a country in this income group, or this income group, or this or that region, or even, Canada or Mexico. Another way, of course, to do this would be to just have a brief addenda, not 2/3, 1/3, but 90-10, for example. And that is on any topic for which you assign a writing of no matter the length, you might say to the students, as we've discussed, one of the explicit goals of our course is to try to ensure that you emerge with a more global perspective than you came in with, and a greater interest in globalizing all that we think about and bringing global lessons into our work. And therefore, although you're going to write about critical challenges in universal health coverage, achieving universal health coverage in the United States, I'd like you to make that 90% of your paper, and I'd like you to make the other 10% about how France looks from that same perspective. I'm sure all of you have many more ideas and better ideas than I have, but I think if I were teaching, let's say, a public health course now, these are some of the things that I would certainly do to try to enhance the global health perspective. And it's easy to see how you could do this for any of the topics we're talking about. Students, the United States spends 17 or 18 or 19% of its annual per capita of its annual gross domestic product on health. I'd like you to talk about A, B, and C in healthcare financing in the US, but I'd like you to spend 20% of your paper comparing and contrasting that with a number of other OECD countries. So again, I think there are lots and lots of possibilities for doing this that could fit in well with what you're already doing, but really add substantial benefits at relatively low cost to you and the students. And there's a range of cases. There's vignettes that you can pick up that are a paragraph. There are, and that cover a range of topics. It's easy to write vignettes. All of you are exceedingly busy, but if you wanted in 3 or 4 minutes, you could write a vignette on practically any topic related to your work, I'm sure. And I think giving students like vignettes. My students always said that they really appreciated that they had an opportunity as they went into a topic to read some vignettes that came from the kind of first person's account of affected people, and that this helped them get into the mood and helped them get into the spirit of what we were going to cover. So I encourage you to look for and possibly even write vignettes. There are also, many of you will use cases in some of your courses, particularly in healthcare management. You're used to using courses as they might use them or do use them in business schools. Most of us in the health-related professions don't use cases that way, but more likely we use cases as examples. So there's a wonderful article, for example, on maternity care in Peru that I always used, that talked about indigenous women who had relatively high rates of maternal mortality giving birth at home. The local healthcare services tried to induce them to giving birth in hospital, and they wound up doing that by agreeing with them that the woman could give birth in the hospital standing up or doing it exactly they did at home, but at least they would be in the presence of healthcare providers who might be able to assist them if there were a problem. There's a wonderful case article I always assign on behavior change communications related to the global polio program in India and Nigeria, where you all will know there were enormous difficulties with getting minority communities to accept the vaccine. And I gave all of my classes that, and we talked about what universal lessons can one learn from there. So whether you use cases like you would at the Harvard B School, or you use them like articles that provide examples of health systems or cultural issues, et cetera, I think there's wonderful opportunities to use them also in a relatively painless but very high-yielding way. And finally, there's COVID, and it's certainly true that COVID is on everybody's mind on the one hand, and yet on the other, in some respects, we'd rather not even talk about it. But it's certainly possible and easy to imagine how one could help to bring a global health perspective by consistently using throughout your course for a semester COVID as a kind of model case. Today we're going to talk first thing about ethics. And here are some of the most critical issues that we're going to cover with respect to our concerns as Americans and health in the United States. But let's be sure at the end we take some time to look at COVID and what are some of the ethical issues that it raises, both with respect to the United States and with respect to other countries, and with respect to global cooperation, for example. Is it okay, for example, for Americans and other high-income country citizens to be getting boosters when so low a share of Africa has been vaccinated? We have an enormous amount of concern in the United States about mandates, for example, for masks. How does this look to our Danish friends? How does it look to our Aussie friends or our Kiwi friends or our Japanese or Chinese friends? And how does culture relate to some of these ethical issues that we're we're going through. What about the ethics of lockdowns and the way they play out? Equity is certainly a topic that will be on everybody's mind all the time. And I think there's an enormous amount to be learned by looking at equity issues in the United States from a really global perspective to see how we look. Even when we look, for example, about maternal mortality in African American communities, let's say in Baltimore, Maryland, when you take a global perspective to that, where would Baltimore fit? How does maternal mortality look in that community compared to other American communities and to other communities overseas? In some respects, northeastern Brazil or northern India has equity issues very similar to those in the United States. And certainly when it comes to equity issues, I'm an extraordinarily strong believer that we really need to be sure that we bring in some of these issues. And COVID provides wonderful opportunities, however dismaying in some respects for that. When we talk about One Health, as we're increasingly likely to do, COVID, of course, is an exceptionally good example of, what we think may be zoonotic spread, but it certainly raises the question of zoonotic spread, and so many re-emerging diseases come from that. What is the extent to which COVID highlights for us the importance of focusing more than we have traditionally on incorporating One Health and planetary health into our courses? COVID has had an enormous impact on the burden of disease. It would be hard to talk about the burden of disease and risk factors without talking about COVID. COVID became last year the leading cause of death in the United States. Right now, I think it's running number 3. It certainly would be valuable and important to say this since what impact did COVID have on the burden of disease in the United States? What impact did it have on other places? Why was the relative impact the same or different? How did that impact vary by age, by ethnicity, by location? And again, COVID would be in many respects the kind of perfect jumping off place for talking about some of these issues. The same for health systems. How did different health systems across the globe deal with COVID? How are they dealing with it now? What about those who've shown zero tolerance compared to those who, like Sweden early on, thought the best route might be achieving herd immunity? How have relatively incapacitated health systems in the low-income countries dealt with COVID or not? What are the costs that COVID has put on health systems? Immunization has declined in much of the low and lower middle income world. Have we been able in the United States, for example, to keep up our childhood immunization rights? So I won't go on, but I'll just say one more. And clearly, when it comes to global cooperation in science and tech, COVID has raised a host of issues about the search for vaccines, diagnostics, therapeutics, personal protective equipment, what we can learn from each other about that and more. So again, you may wish to just to ensure that you're always bringing in a range of global perspectives, and you may not want to have one case that you look at consistently throughout your course, which wouldn't preclude other things. But if you do want to look at one case, certainly COVID opens it up. And the last way that I will talk about, again, you'll have many more thoughts than I will, would be to add a short supplementary textbook. So you might have a textbook for your course, whether it's on health management or nursing and public health or on public health. But one other way that you might wish to bring a more global health perspective into your course would be to add a short supplementary textbook as required or as recommended reading. And you would, as all of you do, you would map what's in this textbook to your regular course. So when you're talking about health systems, you'd map it to this. When you're talking about equity, you'd map it to this. When you're talking about burden of disease and risk factors, et cetera. And it's easy to see how you might, using a textbook in some respects, might allow you to have a more coherent way of trying to add a global health perspective, again, without precluding you in any way from doing any of the other things in addition that can really enhance the learning opportunities of your student. I was touched, and I thank those of you who are using my Global Health 101. I was touched to see that a substantial number of our participants are teaching global health and are using that book. And again, I recommend you consider a wide range of materials to bring a global health book perspective into your other courses. But if you are using Global Health 101, then you may really wish to consider using the primer to add a global health perspective to your other courses, because the primer will be very familiar to you. The organization of it will be familiar, the language will be familiar, the vignettes will be familiar, and it will be very easy for you to map to the other courses and yet provide the students with clear, coherent, hopefully you'll find the book to be clear, coherent, and very easy to read, even though it's scientific and evidence-based. So again, I thank all of you very much for honoring me with your presence. I remind you how interested I am in helping to share ideas if you're willing. Everything that I do is always publicly available. And if you think there's a talk I gave in Rotterdam or Bergen or Dayton that's of interest to you, please don't ever hesitate to get in touch with me directly. So with that, I thank Suzanne again very much for organizing this, and give it back to her.
Thank you, Richard. That was just full of some great tips and information on imparting a global health perspective in your course. Just a little update on his book. His forthcoming book will be coming out in November of 21, so in about a month. Again, this is a very concise book. It's only about 150 pages that really provides an excellent overview of the most important issues in global health. So it's a great way to add that perspective to the course at a very affordable price. The book is only just about $45 for the print book and $18.95 for the ebook version. Also, it can be easily and affordably bundled with any other Jones and Bartlett text for only an additional $15. So with that, I think we're going to go to questions. I have one question here to read. Do you have any experience or know those who use VR/AR headsets and simulations to teach global health?
I don't. It's a very interesting question, and I presume that over time we'll find more and more people doing this. I do know people who are doing this in a number of clinical areas, and including my son, who's an intensivist at Mayo in Scottsdale, Arizona, but I'm not yet familiar. I'll make a note, however, and I will actually take a little bit of a look at this. And again, if you have experience, please don't hesitate to share it with others. I would love to see opportunities, for example, through VR and AR, for kids to immerse themselves with BRAC, probably the most effective NGO in international development and health work. If BRAC, which is a wonderful organization and a self-critical organization and an extraordinarily effective organization, for example, could do some of this and make it available to students outside of Bangladesh, particularly students in high-income countries and middle-income countries who wouldn't have so many opportunities to visit Bangladesh, this, among many other things, would be really wonderful. So I'm going to talk to my friends in Dhaka, and but if you have other experiences to share, please don't hesitate. It's a wonderful question for which I thank you.
When you do a visit or guest speaker exchange, what does the international site usually expect you speak on?
I usually get asked to speak on 1, 2, or 3 different topics. I mean, one will be global health, what it is, and why we should care about it. So, for example, I got asked to speak twice in the last year to the Sarasota Council on World Affairs with a talk about that and then a sequel. But I've also get asked regularly to speak to medical students like those at Erasmus Medical College in Rotterdam in the Netherlands, they asked me to give a series of talks to help them introduce their global health program for students in the health professions. And they wanted me to begin by talking about what is global health, Why should we study it? What are some of the key topics on which I would recommend they focus? And how do I hope they'll emerge differently in order to become very good practitioners in the health professions? The second thing I get asked to talk about is international cooperation in global health. Because of my many years of work at the World Bank and continuing to work in the international arena after I retired from the World Bank, I often get asked to speak about the architecture of global health, the work of international organizations. Recently, I was asked to give a talk on should there be a World Health Organization, and what would the world look like if there wasn't? Often I get asked to talk about a range of international organizations, and now, of course, everyone wants to know about COVAX, the international arrangement under Gavi for getting out COVID vaccines. And the third set of topics will be specific issues. You know, Richard, we really like the talk we saw you give on maternal and child health in low and lower middle income countries. Could you give that talk? We really appreciate you worked a lot on HIV in the olden days, and you've continued to be interested. Could you talk with our students about the evolution of HIV and the evolution of efforts internationally to help to address it in doable, sustainable, fair, and cost-effective ways? Richard, we know you're not really a health systems person, but you've become more and more interested in and involved in questions of universal health coverage. Would we like you to come to class and talk about the quest for universal health coverage, A, B, and C country compared? So it'll usually be why global health, why international cooperation, what about topic A, B, or C? And that's pretty consistent. And even when I get asked to speak domestically, it'll very much be along the same lines. Suzanne, I hope that's helpful to the questioner.
I think so. Quite a range of knowledge you have to speak on all those topics, that's for sure.
Yeah, maybe I could say one more word, and that is the opposite side. You know, when did I call my friends to join my classes, both at George Washington and Yale? So, you know, I'll say teasingly and jokingly about myself that some time ago, a friend of mine at Yale asked me to give a talk to my old business school class there and to do the maternal and child health module. And he extraordinarily graciously and over graciously introduced me as one of the leading people in the world on maternal and child health. And I said to the learners, I was deeply honored by his gracious introduction, but they should understand I'm certainly not one of the leading experts in maternal and child health. However, I said, my friends are, and my friends very kindly call me the greatest paraphraser of the real experts. And so I'm keenly aware that while I try to keep up across a wide number of areas in global health, you know, I'm certainly not the greatest expert on any of them. And there's certain topics in which I'm not that expert at all. So what I tried to do in my class was bring into the classes people with lived experience, practitioners, so-called affected people living in certain environments, people who just knew more than me. I was very honored, for example, we talked about polio. I had worked on the global program, and Bruce Alward, who headed the WHO program, agreed just before he left that job to join my class. There's nobody who can speak better about ethics and health than Ulla Norheim at the University of Bergen. He's led the WHO work on ethical priority setting. He came in and he spoke to this in a manner I could never do. My son's med school classmate headed IRC's work on Ebola in Liberia. We've all remained dear friends, and he's a phenomenal young person of 43. And I told my students, bring tissue, because when he speaks with you about his work in Liberia on Ebola, you will be moved to tears. And so what I'm looking for, and there's a whole array of them from all over the world, you know, whether they're in Liberia or they're in India or they're in Bangladesh or they're in DC, there's a whole array, and although they're busy, many are willing. My students benefited enormously pre-COVID when I was teaching a lot from my bringing into the classroom people with expertise and experiences that I didn't have, who could make things real to them in a way I could never do. And I can't encourage you to do that enough. Suzanne, forgive my enthusiasm. Back to you.
Can you comment on international cooperation and the malaria vaccine?
So, as I'm sure all of you know, until about a week ago, there's never been a vaccine approved for any parasitic disease. As I'm sure many of you know, over the last so many years, I think it's called the RTSS vaccine, clinical trials of that were held in a number of African countries. I think they achieved rates of effectiveness of something like 30%, although it requires 4 doses. So the WHO led a pilot in 3 additional countries. And the conclusion of this was WHO approval of that vaccine just, I think, last week. I think the trials showed that it achieved somewhere around 50% effectiveness. And it does require 4 doses. I'm sure it will be very inexpensive, and the arrangements will be made through Gavi. In many respects, I'm sure people see this as really monumental, and it will be interesting to see how the challenges of getting out a 4-dose vaccine that's only 50% effective, although 50% effective is really something in malaria, to the countries that need it most, and how that then fits in with the rest of the malaria program of insecticide-treated bed nets, indoor residual spraying, intermittent prophylactic treatment of pregnant women, prophylactic treatment of kids, and early diagnosis and treatment. So it's a good question. And again, in some respects, it's monumental, and represents another really good lesson from efforts to cooperate globally and produce a result that will make the world a much better place in a manner that no individual country could do for itself, and may well be something you want to bring into your classes. And international cooperation is much in the air. COVID has raised that in a humongous way. It's raised questions about where did this begin? What is the extent to which the Chinese were open in sharing information? What is the extent to which the World Health Organization is an honest broker, or the extent, by contrast, to which they were too beholden or acted too beholden to the Chinese? How do we deal with issues of sovereignty and international health regulations that aren't enforceable? Will the new panel that was set up yesterday have any chance at all of success in finding the cause? How do we raise money? Will COVAX work? How come COVAX was dependent on a single vaccine in India to a large extent, and then the Indians wouldn't export it? So I think this is a topic that I think we really need to ensure we address in all of our courses, no matter how domestic in orientation. It's a gigantic topic. And the only thing that I would warn against is warning your students that unless they want to be scholars of the practice of international cooperation, then what's important is to learn about who the actors are, to learn about how they play, to be able to think a bit critically about them, but don't spend all your time learning about the processes of how they work, or it will detract from it. You don't have enough time in life to do that, and simultaneously take on topics like childhood vaccines, maternal mortality. What you want to do, I think, for most of our learners is enable them to take on the topics better and understand the place of international cooperation in financing, in policy setting, in technical work, in the development of new drugs, diagnostics, therapeutics, and vaccines, rather than having them come to class and want to spend 2 hours talking about the way WHO works kind of in general. Important, but I would approach it through the topics and how international cooperation relates to that. Suzanne, please go ahead.
We have one more question here, which I think probably a number of people who are in attendance might be interested in. Is financial remuneration expected when inviting global health experts to present in our class? If so, what is a reasonable amount to expect from the presenter?
So Good question. I think there are in the days when people had to come to you. My experience was that when people invited me to come, they always paid for travel, and often they offered small honoraria. Real money, but $300 to $500, let's say. What I'm finding in the days of Zoom is that basically friends or friends of friends are speaking in classrooms all over the world. And since COVID, nobody has talked about remuneration except when I was doing a real course. Like in Milan, I did a whole week for them, and it was part of a master's program. So I think, I think if you ask somebody to give 5 talks in your course over 3 weeks in the first semester, everybody's busy, and it's probably fair to offer them a small honorarium, but you don't need to pay for travel. But I think if you call me or lots of the people that I know and say, Richard, we know you're busy, but our learners would love to have you come in and talk with us about X. Everybody that I know is very willing to do it. Obviously, that's a lot easier if you seek the help of friends, or you trade with friends, or friends of friends say, dear X, I'm calling you about my friends at Wabash College in Indiana. They've really got a wonderful global health program, especially for a small college with some really outstanding students. And my friend Tom Mote is helping them to set this up. And I know you got a million things to do, but I'd be incredibly grateful if you could give them one talk about the global polio program. None of my friends have ever turned me down. What they usually do is you just have to find the right time to do it. And quite frankly, in the days when people are traveling less, even though they're busy, there may be more opportunities for this than before, because it's not like they're spending, not most of them aren't spending. I visited India 91 times over 15 years. I'm not doing it much now. So I think there is a wide array of opportunities that don't require an honorarium, but it's prudent. And the more you build on relationships, the easier it will be. But I think everyone will need to decide what's the limit of what one can ask without offering an honorarium, knowing that in these days, again, some of the money you might have used for a smaller number of speakers in their travel before can now be used for honoraria for a larger number of speakers who will appear by Zoom.
Excellent. Well, I think that does it for the questions today. I just wanted to encourage you, if you haven't done so already, please connect with us on social. If you'd like to learn more about webinars like this that we're doing, hear some teaching tips, learn some higher education trends, read blog posts from healthcare experts. In fact, one of our frequent bloggers is Richard Skolnick. We also announce new products. So we are pretty actively on LinkedIn, Facebook, Twitter, and also we have our YouTube channel where we post a lot of our webinars and trainings. So I encourage you to do so if you haven't already. In closing, I just really want to thank Richard Skolnick for an excellent presentation. I hope you enjoyed it today. I know a number of people have commented in the chat what an insightful webinar it was. My email is swalker@jblearning.com if you have any questions about the book or this presentation. And Richard Skolnick's email is reston.richard@gmail.com. And he is more than happy to email back and forth with you if you have questions about global health or interested in maybe hearing him speak again. So if you want to learn more about the primer, information about it is available at this link at go.jblearning.com/Skolnick primer. And with that, I would like to thank everyone for taking the time to join us today and hope you have a great day. Thank you.